No one is expecting you to dive in there, all Holby City, and take control. That's not your job.
Yeah, you're never going to be leading an arrest on
I would
your
hope not.
first on call.
I would hope not.
Yeah.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
Hi there, my name's Polly and welcome to Coffee on Call, the Foundation Medicine podcast. So today I am joined by Imi and Rachel.
Hello.
And we're going to be talking about your first day on the job and experiencing your first on-call. Now, you, at this point, have been at university for 5 or 6 years and it kind of feels like this day's never going to come, but then first Wednesday of August, you will find yourself suddenly actually being a doctor. So wanted to start by talking a little bit about how you guys felt going into that day. So I don't know if, Imi, you wanted to start by telling us a little bit about how you felt before you started on your first day?
Well, it sounds surprising because it's been, 5 or maybe 6 years. Shocked. Couldn't believe it. What do you mean? I actually am the doctor now. No one told me this was coming. It kind of feels like it's been building for a long time, and then the day arrives and you think, I'm not ready. No one got me ready for this, which isn't true. There's a lot of training that goes in and you're more ready than you think. So I think, quite a lot of nerves, not feeling ready, a little bit of excitement too. I don't know if you had that, Rachel.
I definitely had a whole mixed bag of feelings. I think everyone feels a little bit daunted by it at the start. It's something new, it's change. Humans generally are not good at change in general. But I think, as you say, it has been building up to this moment, and there is a bit of excitement to have finished uni and finally be, starting on the thing that you've been working on for so many years. But definitely nerves.
Mm-hmm. And once you'd got through that first day, did you sort of feel how you'd expected, or was it easier? Was it harder? Was it different than you expected?
I think for me, the overwhelming feeling was like relief. Like you never have to do that very, very first day again. And in theory, every following day should be easier because it's not the first day. So,
yeah, I think the thing that struck me was the things that I was most nervous about, which was the medicine side of things, were not always the challenges that I found myself struggling with on the first day. I think it was, where am I? I am lost. I don't know where I'm meant to be. And, figuring out the computer systems, which can be a bit frustrating sometimes because you want to be competent at something and suddenly you don't know what button to press or how to do a basic task because it's all a completely new system. And I think that is one of the challenges actually, on top of the clinical medicine, but you've been preparing for that for so long, but no one teaches you about the individual systems of your hospital.
Yeah.
even simple things, the code to the toilet.
Yeah.
That mystifies me. Do you know how many times I had to ask for that on my first day? About 4. I was like, I promise my brain works. I had
to write it on a note on my phone.
Yeah. So, yeah, I think like with starting any new job, there's the logistical side.
100%. You can spend 6 years at university. No one will teach you how to use a laptop where it doesn't have an enter key that works and you can't unplug it from the wall. So talking about that, and obviously that some of the things were a little bit different than how you expected, how did you guys go about preparing for your first day? Was there anything that you did particularly, or did you kind of just go into it not knowing what to expect?
I think I can kind of split that into 2. So there's sort of preparing for being the doctor. So I think quite a few people, depending on when you finished your degree, you might have had a bit of break before you started. So you might, the night before, get out some notes, just be like, oh, okay, what is an airway? Let me just check. Remind myself. So do a little bit of revision, not to a great extent, but just reassure yourself, yes, I do know what an A2E is, etc. And then there's the more sort of personal side, like go to bed early, make sure you have breakfast, that kind of thing. I don't know if you felt the same.
Yeah. I would also say I prepared myself by making sure I gave myself a proper break during that summer holiday. In previous summer holidays, I might have worked or something like that, but I wanted to make sure I was really refreshed before it. And then close to the time, I think there was the preparation, like you say, for being a doctor. And I think I went about that by talking to people that I knew who were already doctors and, you know, asking them for their tips and what do you think I need to know, that kind of thing. And a quick flick through the notes. Again, like you say, for reassurance more than anything else. And I think I would read the emails that the trust had sent really carefully, like, where am I meant to be? I'm going to Google Maps it to make sure I'm going to be there on time and I know where I'm going, or I allow myself an extra half an hour in that morning to get to the right place in that morning so I don't, you know, turn up late, that kind of thing.
I think that's it. And I think both of you have touched on it really well there, is that the knowledge of how to do medicine is there. You've spent 6 years at university doing it. The bits you can do to prepare are actually just to make the logistics of your life a little bit easier. And talking about that, you mentioned trust emails and things like that. What was your guys' experience of sort of your trust or your department and how they went about sort of preparing you to start?
Yeah, so I think for most foundation programs now, there's like a mandatory shadowing period of sort of 3 or 4 days where you're paired with the outgoing F1 and you can sort of see what's the day-to-day of the job, get a feel for the place, which I found really useful. I think my advice on that would be is get as involved as you can, because that outgoing F1, remember, is about to be F2 or senior house officer. So they've done a whole year. So they're really knowledgeable and they can give you so many tips and tricks, and they're kind of like your last safety blanket before it's you, before you have to pick up the phone and say, I'm the F1. You can sit next to them and say, oh, can I answer the phone? And, oh, you know, why did you do that? Or how did you know what to say? And kind of ask those silly questions, as it were.
I completely agree with you on that front of using those few days with the extra kind of safety blanket of having someone who's done it before you. Completely invaluable. You know, take the bleep, practice answering those things. You'll be surprised kind of how many of them are, you know, just quick bits, prescribing fluids, prescribing paracetamol, and it's not always the unwell patient that you expect. And I think using that time to navigate your way around the hospital, and I think also based on kind of the trust, they will also give you an induction in your department and kind of for the general beginning of F1, and they'll give you things like your log-ons and you know, they might give you a tour around the hospital. They usually give you a bit of an information pack of maybe bleeps to know, or often it's a booklet that's been put together maybe by someone who has done that job before, and it's full of useful tips and tricks. So I think the induction combined with the shadowing period, I think does set you up quite nicely.
Yeah, I'd 100% agree. And it's that time is the time to get all those little niggly bits sorted. I cannot emphasize enough, check all your logins work before your first day, because there is nothing worse than being on ward round and going, oh, I can't actually write anything. So one thing we wanted to sort of move on and talk a bit about before we started recording this episode, Imi and myself were talking about the fact that we both started on an on-call shift.
We did.
Which meant that our first day was a little bit more stressful than maybe we would have liked. But what we also wanted to touch on was how you can go about sort of dealing with your first on-call and what your first on-call feels like. And for some of you, like me and Imi, that will be your very first day on the job. And for me, it was a case of pretty much spending the whole of my evening with my F2 colleague, pretty much holding his hand and going around the hospital and doing all our jobs together. It might be that you start on night shifts. It might be that your first on-call isn't until your second or third job of F1. You know, everywhere you work is different. But do you guys have anything you want to share about sort of your experience of how you felt going into your first on-call, and how it was, and if anything, you know, sort of stood out to you as not what you expected?
Yeah, so I think just for the audience, if they don't know, on-call means essentially a longer shift that falls out of standard hours. So standard hours are sort of 8 or 9 to 5-ish, which is when you've got lots of lovely people around, like you've got the pharmacists, you've got all these people who can help you. And this is when you're in the evening or you're overnight or the weekend and there's less staff. And you normally carry a bleep, so some kind of device that the nurses or whoever can contact you on to say, hey, we need help. And as Rachel mentioned, it might be something simple like, oh, could you prescribe some more fluids? Or it might be, you know, Mr. Jones is very unwell, I need your help right now. And that can be a bit daunting because until you pick up the phone, you don't know what's going to be on the other end. which is kind of a skill in itself. So my first day was a long day on call. So that meant I worked 8 till kind of 9 p.m. And I carried 2 bleeps. I carried one, which was the one I mentioned, where sort of the nurses can call you for jobs. And I carried a crash bleep, which meant that I had to go and attend, say, if someone was very unwell or they had arrested, we would go as part of the team to try and sort of perform resuscitation. And it felt a bit like I was holding a hand grenade. I don't know about you, but it was myself and another F1, and one of us had to carry the crash bleep. And it was like the world's worst game of hot potato. We were kind of going, oh, would you like, oh, no, you can, well, I can, should we? And then, yeah, I took it. So, but actually it didn't go off on my first day. So I felt quite relieved. And it's worth remembering that if it does go off, you are a member of a much bigger team and you are the most junior member of that team. No one is expecting you to dive in there, all Holby City, and take control. That's not your job.
Yeah, you're never going to be leading an arrest on
I would
your
hope not.
first on call.
I would hope not.
Yeah.
So when you are carrying a bleep and you're receiving sort of, calls from people all over the hospital, what sort of things can people expect to get bleeped about on their first on call?
So, I mean, like I mentioned earlier, not every bleep is going to be that hot potato of someone's dying, we need you immediately. And I think that was something that struck me actually holding the bleep during my shadowing period, is that there is so much of, this patient needs paracetamol, this patient needs fluids, please can you do this quick job for me? And actually, in the grand scheme of the number of bleeps, it's not a huge percentage that is unwell patients. I don't know if you guys have experienced a similar thing. Yeah. And then you know that when you do get those bleeps about the unwell patients, sometimes it can all happen a little bit at once and you feel a bit overwhelmed by it. But I think, just sitting back and prioritizing those bleeps that you've got. Obviously, an unwell patient has to take priority over the other jobs that you have, no matter how much they're piling up. But I think it's definitely that prioritization and kind of linking back to the on-calls, it's that time management, because normally on a normal working day, you've got a ward round in the morning, you do your jobs in the afternoon. On an on-call, you've got this bleep, which is an added extra layer of responsibility. Yeah. And you don't have that usual day structure. So it's about linking in your own time management, your own prioritization skills, kind of putting that into practice.
Yeah, it's all those skills that you start working on through university start to come in there when you're there. And we mentioned a little bit that not every bleep is an unwell patient, but some of them will be. And Imi, did you have any experience of managing sort of sick people when you were on your sort of early or first on calls?
I did. In fact, on my first day, I had quite a sick gentleman. And I think, in a way, it was quite helpful that I was exposed quite early on. And my first rotation was surgery. So depending on what department you're in, there'll be different structures with your seniors. But in surgery, a lot of your seniors, the SHOs, the registrars, will be in theatre doing cases. So you don't immediately have that senior support. So it's actually really good for your learning and sort of your confidence and competencies as a doctor that you need to go assess the patient, do an A2E, and put in certainly sort of the initial management and then call for help. And you just know if you're in a surgical specialty or one similar, you might have longer before someone can come and help you, which is okay because you've also got lots of allied health professionals. Certainly in the hospital I was in, we had what's called a critical care outreach team, or sometimes it's DART, deteriorating adult response team, all these catchy names, but essentially they're very experienced, often ITU nurses who can come and offer their expertise and sort of support you, which is invaluable, especially when you're finding your feet and you're kind of baby duckling doctor thinking, oh, should I do a blood gas? So it's just really nice to have that support in the moment. But it really is your basics, just doing your A2E. I don't think there's ever a situation where doing an A2E is the wrong idea. I don't know about you. No. I mean, obviously I'm emergency medicine focused. I'm a bit biased, but yeah. And then when you then call for help and you do your SBAR, and we'll talk about that in another episode, you've then got a structure to say, I've done this, and reassure yourself that you've thought about their airway, you've thought about the circulation and so on.
And going back to what we were saying about induction and the things the trust can teach you, finding out who those people are is a really great thing to do in those first few days. Who have I got went out of hours to call? Is there someone like a critical care outreach team? Does my hospital just have the medical registrar and surgical registrar, or is there a team of other people who are going to be able to help me? And I think the most important thing is there is always someone to come and help, whatever time of day or night it is. And I don't know if this relates to either of you guys, but I sort of felt that I became a doctor on my own calls, and it's where I got to do a lot of the actual doctoring, to put that in inverted quotes. You know, a lot of your day job when you first start is writing notes, putting requests in, speaking on the phone to families and things, but actually getting to manage sick people out of hours, or even just doing the prioritization and time management skills, was where I really started to feel like, oh wait, actually, I am actually a doctor now and I'm doing doctory things.
Definitely. I feel like it's where you learn the most. You build your confidence. You recognise who's ill, you know, because as a student, you come across people on placement, but often people deteriorate out of hours. And that's when you can recognise, you know, your end of bedogram. You can look at them and go, you're not quite right, and I need to assess you.
Yeah, and I think my threshold was much like lower for that initially. So every patient that I got called about, I was thinking, oh gosh, this is the sickest patient I've ever seen. But actually, it comes with a bit of experience to know this patient, yes, they're sick, but they're not, critically sick compared to another patient who is. And it is an experience thing, but definitely those on-calls is where you form those experiences.
And it is just all experience. And that's why, like, now speaking as someone who's a little bit more senior, I'm always happy to go and see these types of patients with new F1s and things, because I've got an extra 3-4 years experience. That means, I can sort of say, oh yeah, I've seen this before and I can do that. But it's where you sort of learn that judgment and learn how to manage people. And I think that's been my overall takeaway for managing your on-calls is always ask for help when you need it. Always go and see the patient if you're not sure. And, there is always somebody to get advice from if you need it in those first few days. So I think we'll start looking at bringing this episode to a close. And as we do with all of our Coffee on Call podcasts, we finish it with sort of your big takeaway or the thing you want to pass on to our audience. So if there's one piece of advice you could give yourselves on your first day or going into your first on-call with a little bit of hindsight now, what would it be?
I think it might be wear 2 lots of deodorant and carry an extra cereal bar. Just prepare, smile, tell people it's your first day and it will be all right.
Yeah. The vending machines are expensive. Always bring more snacks than you think you'll need.
Yeah, I think, my tip would be just get to know everyone on your ward and in your team, know their names, get the phone number of the registrar or the bleep number so that you can contact them. And like you say, know that there is help available and everyone's kind of there as a team to support each other.
Yeah. No one expects you to know what you're doing. Just go in, smile, say, hello, can you help me?
Yeah. And I think to close it off, I think mine echoes both what Imi and Rachel have said, which is really that you know more than you think you do. You've spent a lot of time at university training for these first days and these first on-calls, and you always have a little bit more time than you think you do. There are very, very few things in medicine that can't wait 30 seconds for you to have a think, ask a question, or have a quick drink of water before you go and see them. And on that note, we'll finish this episode. Thank you very much for listening. This has been Coffee on Call, the Foundation Medicine podcast.